Welcome to the Just Word Podcast. I'm Pat Bolland. The Just Word Podcast is brought to you by Justwealth, investing the way it should be, just for you. Well, if you're in the healthcare space, and I'm not talking about doctors necessarily or nurses necessarily, but if you're an occupational therapist or some tangential health professional, then you probably don't get the financial services you think you deserve. So, to address that, our two guests are going to be talking about allied health. Currently, it's a podcast. They're moving into a new format come the fall, but to give us kind of a precursor to what that's going to look like, they're joining us now. And Giacomo Silvestri and Ryan Wells join us. Gentlemen, great to meet you.
Likewise, Pat. Thanks for having us. We're really excited to be here.
Okay, tell me about Allied Health, because I know you've got kind of an educational podcast as it stands currently, but how did Allied come to be?
Allied Health is a bit of a passion project from Giacomo and I, and over the course of our kind of approximately 8-year career, we have come across a number of individuals who have come to us with the most fundamental of questions, such as, what kind of interest rate should I be looking for on this? Why should I be paying off my credit card versus investing our money? And we recognize that the financial literacy among the allied health profession was really not great. And when you look at the reasons why, it's easy to see because it's not taught very well in high school. A lot of individuals don't get it when they go to their university careers. And then when you are in school, it's really focused on how to service your patients to the best of your abilities. But what's really left out is how do you kind of take care of your own financial wealth?
Fair enough. And you guys come to it as physiotherapists. Am I right in saying that?
100%. Ryan and I met in physio school at U of T, and we're both, I guess, classically trained physiotherapists, if you will, both working in the private practice area in Toronto. So we're not in hospital. And yeah, we've been great friends for, I guess, 10 years now, and just both happen to have an interest in things personal finance and investing. And like Ryan said, we've noticed that friends and colleagues of ours who didn't have the interest, which, as personal finance nerds, we understand that not everybody has that interest. I would say most people probably don't have that interest. But it was amazing for us to get all these questions and just enjoy talking about these things. So we kind of took the next step and took things online.
Okay. So currently, you're an educational platform, if you will. Talk to me about what that is, what that means, and then we'll get into what you're going to do in the fall.
When we first started out, we started out with some really fundamental ideas. So we went on and we wrote some blogs and we did a number of podcasts, such as what are stocks, what are bonds,
Wow.
why would I purchase an ETF, the difference between using a mutual fund at your bank versus perhaps a robo-advisor. Some of these really fundamental concepts just to kind of get people the knowledge that they need to start to make their own informed decision. As you mentioned, we're an educational platform. We are not registered financial advisors. We don't give out advice. We just try to arm the healthcare community with some of this knowledge so that they can come to their own decisions and make a more educated choice.
Okay. What's the feedback been like to your educational platform, the podcast, for instance?
Overall, it's been quite positive. We've had a lot of people talk about the fact that, like Ryan mentioned earlier, this stuff really isn't talked about in high school. I mean, that's starting now, but for most of our listeners and most of the healthcare professionals in Canada, that's long gone for us. But it's great to see that people are starting to find this digestible. I mean, we, being physios, try to bring it to the healthcare profession and make it relatable, I guess, as best as we can. And it seems as though, we are getting a lot of good feedback with people finally understanding some of these concepts that they thought were completely foreign to them or inaccessible. And I mean, Justwealth does this really well as well. It's kind of takes personal finance and investing and demystifies it somewhat to show people that they can manage some of these things on their own and understand at least their finances a little bit better. So it seems like we're we're getting there, and people are really starting to understand some of these concepts and yeah, take more control of their money.
Well, it's interesting because the stock market was hot, hot, hot for years on years. And then all of a sudden this year it got cold, like ice cold, and you had a decline. To me, that would be a confusing event. What about your audience? Are they even up to speed on something like that?
Yeah, it's a really good question. And when we started the podcast, it was kind of right after the downturn, March 2020. And so things started to look up. So it was very easy for us to preach, go ahead and continue to invest, because it's easy to invest when you're seeing things go up, when that market is a little bit more bull. Once we started to get across some of the more fundamental principles, then we were able to tie in some kind of real world events. So how to invest during an economic downturn was one of our really nice podcasts. And as we start to move from kind of the fundamental knowledge to the application of this, I hope we've been able to walk some of our members through some real world scenarios so that they can manage their emotions when it comes to investing, something that is very, very important, especially when you're investing during a time like this.
Okay. What was that advice? What did you tell your investors to do in an economic downturn? Because it applies now as much as it did 2 years ago.
Well, not to say that we have the same financial background or acumen as James Gauthier, who you had on your podcast a little while ago, but it was pretty similar. I mean, and again, like Ryan said, we're not registered financial advisors. We can't actually give individual financial advice. But when you look at the research, if you have the time horizon and you just keep doing what you're doing, as long as you're doing something sustainable, in the end, if you have enough time, things, should be okay, or at least historically have been okay. So it's really been, I think the crux of our advice has been, don't panic. If you're doing something that you're comfortable with, that has been working for you up until this point, it'll probably keep working for you. Just be consistent, potentially turn down or turn off the news if you can, because it's usually not helpful. And just kind of keep chugging along. You'll probably be okay.
I know, as a former news person, I should probably defend that profession, but I get what you're saying. Sometimes there's a lot of noise, as you put it. But okay, what happens now in your future? What are you doing in the fall?
So in the fall, when we first started Allied Health Financial, it was really to recognize this dearth of knowledge in the healthcare space. But we wanted to take it one step further than that. And that would be to help individuals attain some of these products that would be relatively difficult to obtain on your own. So if you work for a massive company, then you kind of have this opt-in, opt-out if you want to do your investing or health benefits and stuff like that. When you're on your own, those are more difficult because you just don't have the mass, you don't have the size and numbers. So we are working towards getting healthcare professionals, especially those that work in private practice, the benefits and the services in the financial world that we feel that they deserve.
Okay, what does that include?
Yeah, so we're going to continue really with that education first mindset. It's, I think, as healthcare providers and most of us who work in private practice, we love that continuing education and really being informed. And we always call it best practice. It's what we always strive for. But the goal is really to bridge the gap between what our colleagues in the public sector have. So in Ontario, they have access to things like Hoop, which is an amazing opportunity that a lot of independent contractor healthcare providers in private practice don't have. So the goal is to bring together different people, products, and services that we have done our homework on, we trust, and Ryan and I use ourselves, and build a community around them so that healthcare providers have access to the financial products that they deserve and can take even better care of their finances.
And those would include services. And those would include services that would help you both build and preserve your wealth. And I think that's as much of a teaser as we're going to leave open to that.
Yeah, except that it sounds to me you're not financial advisors, so it's not like you're going to be providing that service. Are you like a referral agency? I mean, that's the easiest way to express it.
I guess you could. A referral agency, it would be a similarity to that. We're more like a congregator of people. So we could definitely be considered a connecting agency, but we want to bring together the individuals to give them the power of the masses.
Yeah, basically we've talked about big organizations like Hoop, and then you have larger employers in other fields, that do have access to employee health plans and those sorts of financial products that we don't really have access to as independent contractors, or they're just not. I don't want to say they're not very good, but they're not the same quality of product. For instance, if you're looking for extended health benefits as an independent contractor physiotherapist, we do have access to some products, but you have to undergo the underwriting process, which you don't necessarily have to do as an employer. Or you can access investments through your bank when there's which are not necessarily the most economical or cost effective. So what we're really trying to do is we're trying to form a group, if you will, is probably the best way to describe it. And through a group of healthcare providers, we get the power of numbers. And through the power of numbers, we're able to get different discounts on services that we know are excellent. And we're also able to create new products through people who are licensed financial advisors and are able to provide that kind of advice or provide those products in order to give healthcare providers in Canada access to these products that they haven't had before.
Okay, so walk me through some of the products you might possibly offer. So accounting services, investing, insurance, property and casualty, or even liability insurance. What do you would those be in the spectrum?
I'd say that those would definitely be on the horizon, definitely on the list, and those will be just some of the ones that we hope to initiate with, and there won't be many that we won't hope to include. We hope to make this as broad range and provide as much value as we possibly can, but definitely the services you mentioned are high on our list.
Okay, so then if you're a quasi referral agency, and I'll use that term loosely, how do you actually get paid? How will Allied get paid?
That's a good question. We, as healthcare providers, we and we basically are there to do a job that it tends to be very what's the word that I'm looking for? We're there to benefit other people, but we still need to get paid to do that. So we've kind of taken a similar, and that's because what Ryan and I are really comfortable with. We've taken a similar approach. So in order to be able to connect these things and have the back end for people to access, there does need to be a cost to the service, and you're right. So there will be a membership fee to join the group, as there would be with any kind of professional association or whatnot, in order to cover some of these back end costs. And that's the main way that there will be, funding through there. Some of these member organizations or people who want to provide a product through Allied Health Financial will also be having like a hosting fee, I guess, on the website as well, again, to cover some of our costs in order to allow us to provide these services to people.
It does beg the question. It sounds like a great idea. Will it be open to people outside of the health profession?
That's a really good question. And initially, the scope of the products are definitely tailored more to somebody in the allied healthcare space. And so when you look at some of these services that we're providing, let's take maybe accounting for example. We've gone out and we found somebody who's very, very knowledgeable and has a specialization in the healthcare world. So some of these things will be directly tailored. Now that begs the question, hypothetically, if you were outside the allied healthcare space, could you? Yes, of course. However, some of these products they might just miss the mark just a tiny little bit, but there's no reason why perhaps we wouldn't be able to have an allied healthcare professional include their partner or their spouse or their family in this, something like this?
Oh,
Yeah, the biggest part of it for us, I think, is it's all started as a passion project. We're here, kind of equity for healthcare providers and private practice is really where this all started for us. So I think at least in the foreseeable future, it's pretty much going to be almost for allied health professionals by allied health professionals. But we'll see what we can do for others. But I think at the beginning, it's really a bit about a passion project for us and our colleagues, and hopefully the future of the professions as well.
okay. But if it's a membership and people join, if you will, how interactive is it going to be? Will there be some kind of a feedback loop where people can say, "Hey, listen, I had a bad experience with X, Y, Z investing. Can we do something about that?" Or how interactive?
Great question. And obviously, customer service will be a big point for us. And we hope that we have headed off as many of these issues at the pass as we possibly can by choosing our partners very wisely. And if there is an issue or should an issue arise, then the contracts are in place to be able to protect both us and our members so that we can continue to provide the best service possible.
Okay, sounds like a fabulous project. Are you guys getting excited?
We've been excited for 2 years, so we're getting to close to launch date, so we're getting very, very excited about it. And we hope it's something that's going to help our members for a long time.
And if anybody was interested, how would they see the progress and when your launch date is going to happen?
That's a great question. So the best place to stay up to date with that is at alliedhealthfinancial.ca/founder. If you put your email in there, you'll get access to kind of the first information as when we're ready to launch. And they can always find us on anywhere you listen to a podcast, wherever you're listening to this podcast, with the Allied Health Financial Podcast. And then we're on social media everywhere as well.
Giacomo, Silvestri, and Ryan Wells, the founders of Allied Health Financial, thanks so much for joining us.
Thanks for having us, Pat.